Hi, it's Beth, one of the journalists at Manx Radio again, and still on the theme of the Chief Minister's pledge in Tynwald this week to look at services across government and drive through efficiencies. We've got the reaction now from the CEO of Manx Care, Teresa Cope.
I think we're grateful that the sort of financial challenges of the system have been acknowledged, particularly in relation to health and social care. So we know we have a significant efficiency challenge, and this is very much a focus of Manx Care. We recognise that the funding formula from Sir Jonathan Michael's report of 2019 were not able to fund health and social care at that level, and we understand that. And we also need to make sure the services that Manx Care provide are as efficient and as effective as possible. So the acknowledgement is really welcome. Over the last 3 years, Manx Care has driven out £21 million worth of cash out savings in the system. And we have a very ambitious plan to deliver a further £18.5 million in this financial year. So looking back over 4 years, we will have driven out over £40 million worth of cash out savings and several £million worth of efficiency savings on top of that.
I suppose, though, from the public's point of view, that's one thing that you're saying, but what they're saying is that their taxes have gone up to pay for healthcare. So where are they going to see these savings, I suppose?
I think that's a good question. There is an infinite demand on healthcare. And I think that means that whilst we have a responsibility in Manx Care to be as efficient and as effective as possible, there will still be inevitably a funding gap to bridge. And I think that's where we have to get into those bigger conversations with the public about what should services look like on the island and what can be afforded. And I think that is that collective responsibility that Manx Care has with working with the Department of Health and Social Care and also with government, because we are not going to bridge this funding gap through efficiencies. Efficiencies play a significant part of that, but equally some decisions about what we can afford to deliver and what can be afforded to be in place on the island is really important.
The person on the Isle of Man listening to that, though, will hear the word efficiencies and naturally think it means cut to services. Is that what you're talking about?
When we talk about efficiencies, we are trying to do more with what we have got. So we are trying to preserve our services and protect them from being cut or curtailed. And that is our responsibility, and that's part of the programme that we have, making sure the money that we have is spent as wisely as we can, and we can evidence value for money on behalf of the public. That is what Manx Care has been tasked to do. But ultimately, making our system and our health and care services as efficient as possible, and I would add into that as safe and effective as possible, we can only go so far with that. And I think even when we have achieved a level of efficiency, which we would all feel would be appropriate, there will still be a funding gap in terms of what health and care costs for what is currently mandated to Manx Care. And there will still be some difficult decisions to make. Over the last 3 years, our spending in Manx Care has been slightly less than inflation, which I think is a really good indicator of how we have managed to do more with the money that we have. But the pay increases, and Manx Care is predominantly a pay organisation in terms of 80% of our pay goes on our workforce. That has cost us an extra £30 million in the last 3 years. So that's a significant amount that in order to keep our services of the right standard, it is going to keep costing us more because all of our costs are our workforce.
But some of that workforce isn't on the front line. And again, there is a perception that there are a number of managers in Manx Care. So how efficient can you say that Manx Care is within dealing with management team costs?
Yeah, I'm aware of that criticism of Manx Care. Our management costs do not benchmark any higher than any other organisation of a similar size trying to run comprehensive health and care. And when we talk about people who are not on the front line, that isn't just managers sat in offices. There is a huge number of roles which actually support safety and compliance and the delivery of frontline services. The example I would give is we now have a team of MDT trackers, multidisciplinary team trackers within our oncology and cancer services. They are fundamentally critical to mapping and monitoring the patient pathway as they go through cancer services. They are not classed as clinical people. They are not necessarily really on the front line, but they are critical to the effective running of those services. There are numbers of others. We've talked a lot about the non-compliant position we inherited around contracts and information governance. And those are two of the departments where we have had to put additional workforce in to enable us to become compliant with that. And effective contract management and effective information governance are critical to the running of health and care services.
I suppose from your point of view, it's quite difficult to communicate that to the public, isn't it? There's a lot, it sounds like, going on in the background that actually doesn't affect the everyday person. They just see that first point of care, and trying to explain that, I think, to be fair to you, is quite a tricky thing.
It is, but I also recognise that we really have a responsibility to try and explain that better and help people's understanding. So we will be publishing in our annual report a section which looks back over all of the investment that Manx Care has made since it was established 3 years ago, because I think we want to be able to say this is where the money has been invested, and then people can make up their own minds. So we need to be able to articulate that in a much more transparent way.
The Chief Minister then has indicated that we have to now make a proper assessment of Manx Care spending. You've said, we've still got that funding gap. How is that assessment going to be made, and who is going to make these difficult decisions that you're talking about?
I think we are part of, I would expect Manx Care to be part of those discussions in determining what that should look like. Ultimately, Manx Care is given a mandate every year about what we are asked to deliver in terms of services, and we are doing that to best of our ability. We have just published our comprehensive operating plan in response to this year's mandate. How we achieve those savings, we have to do that jointly. As I've said, there are some difficult decisions to make. Manx Care has to demonstrate it is operating its services as efficiently, as effective as possible and safely. But ultimately, it is the Department of Health and Social Care who will have to make some decisions about what we will or won't be doing going forward. And that will translate through into our mandate for next year. We absolutely welcome the scrutiny, and we welcome people to really understand what it costs and what it means to deliver health and care services for the island. We've been through a comprehensive inspection regime. So we have got all of that to respond to. And I think this is the fundamental difficult question, is with the money that is available and with the efficiency that can be driven out over a period of time, and we're on that journey, what can the island afford to fund within that envelope?
And you've been quite clear before that things like staff retention and attracting staff over here is key to the costs. We know that it costs more to get locums in and whatever. And I suppose the nervousness around healthcare and the spiralling costs all comes down to sometimes the situation that you're given.
Yes, and we know there has been, we're not just talking about the increased scrutiny from regulators telling us where improvements need to be made, and the Sir Jonathan Michaels report. But equally, we are constantly developing new strategies, which will, again, have expectations. So, the publication of the autism strategy, that will have funding implications. Other strategies, the suicide prevention strategy, again, funding implications. These are all strategies that are absolutely necessary. We need those. But equally, they all come with some investment requirements in order to develop some of those services. We will always try and develop those services through efficiencies, recycling that funding and putting it into different things. But that will only go so far. And as I say, for any organisation to have a cost improvement programme totalling 18 million just to achieve balance is a substantial ask.
How confident are you about the future of healthcare on the Isle of Man?
Manx Care's role is to make sure it is delivering its services to the highest possible quality, as safely as possible, but also as efficiently and effectively as possible. That is our job. However, even if we are the most efficient organisation and can evidence that, the likelihood is there will still be a significant gap between what we have and what we need. So there will still need to be some difficult decisions made about what health and care on the island should look like and what is affordable.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.